answering this question right here. The pros and cons of home care. Why home care? First of all, it's like somehow I didn't have a choice because when I signed up for this company, they were the most rapid in answering, and the process after signing the contract was really fast. It was even faster than my process of going to Germany, supposedly. I had two options back then. After I passed the B2 certificate, I was supposed to go to Germany, but on that same day, I passed my US visa interview. That's why I'm here. Now, the pros and cons. That's 1:1 care. You get to focus on one patient at a time, no splitting attention between 5 or more beds. In the Philippines, I've experienced even 28 beds, just one RN, me. Crazy. There's also flexibility, that's number two, but in a sense where your schedules can either be 8 hours, 6 hours, 4 hours, 12 hours, and 16 hours straight in one day. So you might get long shifts and fewer days, or you can get more OTs, or you can get shorter hours per day for more days in a week. Some agencies are accepting part-time or per diem. The third thing is less physical burnout. This really depends on what kind of patient you have. Pediatric home care, you wouldn't need to do heavy lifting a lot because your patient isn't heavy. If you're in adult home care setting, well, you may need to do this a lot, but there's also what you call a Hoyer lift. But even though you have a Hoyer lift, our patients here are usually bigger than Filipinos, Filipino women. It's kind of hard to do reaching other than the lifting. You have to keep that in mind. Also, since this is just 1:1, there will be fewer blue codes or none at all in a week, in a month. So no consistent running and no consistent walking from room to room. Another pros, I'm not sure if this is really a pro, but autonomy. You are the only healthcare professional. What the freak? So you're the only healthcare professional in the home. You are independent in practicing your clinical judgment. But you should be aware of this. The parents, when you're in a pediatric home care setting, the parents are supposedly trained. So even though you're the sole medical professional in the house, you're still a part of a team, meaning you as a nurse, the RN, and the parents. Or if there are older siblings, you're not the only one doing all the care. You should be doing it with the parents, with all the extra hands if you need to. You shouldn't be alone. But in reality, that depends on the family, whether they think of you as a part of their team or just their helper in carrying out the care for their family member. Sometimes, in some families, they just literally leave you alone. Another benefit is you could have a stronger patient-nurse relationship. You become a part of the family's routine. I've experienced being in homes where you are offered breakfast, lunch, dinner, depending on your shift. So you literally become a part of the family. And the last benefit is, of course, you'll not be exposed to hospital hazards. So no overcrowded ER, no floating to unfamiliar units. But there's a downside to that. I'll talk about that in the cons section. Also, reduce risk to infectious diseases unless one of the family members have them. Now let's talk about the cons. One is, of course, isolation. Sometimes, in some cases or in some families, you would feel that you're not a part of the team at all. Or there's no team at all. It's just you and your patient. When you have to call 911, or in our case, living in a Jewish community, the Hatzalah, it's gonna be you who got a call. Or if your patient is sick that needs some new medical orders, most of the time, the parents do that. But during Shabbos or Sabbath day, it's just gonna be you who will do that. Oftentimes, you'll feel lonely, or if you're new, you'd feel Like, hey, this is risky. You'd be afraid. Number two is unpredictable home environments. You might deal with unsafe neighborhood, hoarding situations. Oftentimes, in the pediatric case, family members who will interfere with the case. And that can be irritating sometimes. Well, most of the time. There are some people everywhere who thinks that they're the doctor because of Google or nowadays because of ChatGPT. Another thing, limited immediate support. If something goes wrong to your patient, it's only you. You will stabilize the patient. You will be the one who will call unless one of the family members can do that for you if they are not in a panic mode. In a healthcare setting, you don't have a crash cart, but you do have emergency stuff that you can use just in case you need to. Another thing, inconsistent pay or inconsistent hours. If your patient gets hospitalized, well, or maybe move somewhere else for the holidays, your shift might get canceled. And sometimes with just a little to no warning at all. I've experienced going to a place for my shift because my patient was hospitalized before. I went to that address on CubHub, and when I got there, the family wasn't there, the patient wasn't there because it's a holiday. I have to drive again for 9, 11 minutes just to go to the other address because the office didn't update CubHub. That could happen sometimes. Other times, your shift would get canceled for the whole week because your patient got hospitalized. And example, on the day that your patient would return, supposedly from the hospital, you will have to wait and cannot accept any other shifts. And sometimes they wouldn't get home on that day. So you lack the hours. On the next payday, you wouldn't have enough. Another limitation is the scope limitations. You're not constantly exposed to new equipment or fast-paced clinical learning. Most of the time in home care, it's slow-paced unless there is an emergency. Or, of course, if you have to go to the school with your patient for pediatric home care. Sometimes home care nurses feel like they get a little rusty because of not being exposed into these clinical fast-paced settings. For some people, that's okay. And for some, that isn't okay. It just depends on your preference. And the last is the emotional toil. Long-term pediatric care can become like family, which makes grief and emotional boundaries harder to manage. I myself became so attached to my patients, love them. And seeing them again after a long time would surprise you. It's an amazing feeling to see them grow before your eyes and progress before your eyes. And if you have to leave, you have to go, or if they have to be released from care, it's hard because you got attached and you dearly love them like they're your own. If you're thinking about doing home care, oops, as a registered nurse, just know it's rewarding, but it's not always easy. I'll answer another question tomorrow.